Thank you very much, Sue. And thank you everyone for joining us from all around the world. So in case you're trying to think and place my accent, I'm originally from the Caribbean. I was born and brought up in a lovely twin island of Trinidad and Tobago. And in about 2021, we were rated the happiest nation in the Caribbean. So it's a lovely place to be. And last weekend, we would have had Carnival in Trinidad, which is better than the Brazilian Carnival. Just my little tip. But welcome to our Brazilian followers as well, if they're listening. Um, it's a pleasure to be here and alongside Maria tonight to just talk to you and share with you all first a little bit about me and the fellowship, and then we're going to really move on to the meatier bit, which is Maria and her work. So just for context, most people know about Mary Seacole, who was a nurse who served during the Crimea War. But we know because of biases and racism in play, Mary Seacole's work had been played down as opposed to Florence Nightingale. Mary Seacole now has her work and what she did is gaining recognition momentum. In my early stages after I completed my doctorate, so it's my postdoc really in 2012, I was awarded a fellowship by the Royal College of Nursing to be a Mary Seacole, a leadership program, named the Mary Seacole Leadership Program. And I learned so much from that program. I had women like Janet File, who some of you are UK midwives would know, Obi Amadi, Professor Carol Baxter, Dame Elizabeth herself. And they were all women, and Tom Sanford at the time, all women who guided me and molded me into this whole area of inclusivity and everything I did and wanted to do. But then that program moved away from the four unions and colleges running it, and it sort of went to a different organization. But what that program did, it instilled in me what a fellowship can do, how a fellowship can help nurses bridge what they experience. And I didn't know much about Mary Seacole, but what I started to realize was that her values aligned to my values. And we had those commonalities. So as I grew and I developed, and my work began as a professor, looking at the interplay between culture, gender, race, and society, I started to think, how are we equipping nurses and midwives and health visitors to actually go and deal with the problems of exclusion in our society and communities? And Dame Elizabeth and I were chatting one day, and we were talking to her then, and I went away. And then Elizabeth will tell you this. I rang her up one day and I said, Elizabeth, I'm not going to wait till you die to do something in your name. I'm going to do it while you're alive. And she just went, oh, charming, Calvin. Thank you. You know, and there we had that conversation because I was seeking Elizabeth's approval before I used her name. And then there were wonderful people at Health Education England who I contacted, and they listened to me and they heard what I wanted to do, and we did a proposal for a pilot project, and we got the funding to run the Dame Elizabeth Anionwu Fellowship for Inclusivity in Nursing and Midwifery. Brilliant. It started, we recruited a cohort, and part of that program was for nurses at any level. So you could be an entry level, a midwife at entry level, a health visitor, but you needed to, part of it was to expose people to the space, because we often talked about space in the program, where space is important for thinking, for reflecting, for understanding, and seeing where we go and how we navigate things. So we created this space and we said, this is how the fellowship's going to work. It was really dynamic learning. It was more of a relationship building program. And it'll sound weird to you when I say it. We were working with nurses and midwives on this fellowship to develop a relationship with their patients and clients who we'd never seen, and they may never know who they will meet until they meet them. So it was building this side of the relationship. How do we build positive, inclusive relationships? And that's what the fellowship was about. How to be inclusive in gender, race, disability, sexual orientation, all these areas. How do we begin to do it? And as part of that 9-month fellowship program, we had participants or candidate students, they needed to do a change project. And Maria will tell you later what her project was. So for me, it was really and truly about how we opened up a space to run this fellowship program. Alongside the fellowship program, I also launched an annual lecture. Our first annual lecture, which is available on YouTube, was delivered by Professor Laura Sarant, and she looked at how much progress have we made since, as the first lecture. Our second lecture was delivered last year in October by Nicole McIntosh, who is the head of nursing for London for WTE, previously HEE. And Nicole looked at inclusivity and inclusive language and how language matters, something, again, you'll hear from Maria today. The program, you may want to ask me, how do I get onto it? I'll tell you really quickly. It's an application process. It's only for people in England at the moment. So I'm sorry about the 4 nations. We haven't gotten there, but we will try to. It is funded in terms of your time for the program is paid for. The educational material is funded. It's an agreement with your host hospital trust, so they pay your travel if you're outside of London. And we try not to be London-centric. Our first time we had candidates from all across, so which worked really well. We had a wonderful celebration at the end of the program where everyone comes together and talk about their project, and they invite their colleagues, they invite their patients if they wanted to, whoever, were in their circle that supported the work and they want to know about the work. So for me, the Elizabeth Anionwu lecture and fellowship really and truly is signaling a message to our nation. First of all, and when I say our nation, our patients, those who come into our care, that we want to get it right for them. We know we don't always get it right. And what this program does, it signals an investment in nurses and midwives and health visitors who want to make a difference, who we can then go out and see how it changes things. You'd hear of Maria's project today. One of the other women on the program, her project was looking at how people feel valued and included in their appraisal process. So, when you go for your appraisal and they give you a 3 out of a 5 or a 2 out of a 5, what does that really mean? Without any context, a number is quite punitive without context. So she looked at, and she's changed it for her department, and now her trust is adopting it as a policy of changing their appraisal process to be more inclusive, to take the views of staff. So what we're looking at is really how we begin to change systems through a project like this. So our fellowship program, as I say, signals first to the nation, who are our patients and future patients, that we want to get it right. We want to include them and make sure we do it, the way it should be done, care, that is, deliver care and health promotion packages. Secondly, it's based on the values of Dame Elizabeth herself. You can read much about her. You can go and Google her. As Sue said, she's been on this program before, so you can probably search for those videos and look at those interviews. And then finally, so it's based on her values. And finally, it's about leaving a legacy around inclusivity, because if people feel included, they will also feel they belong. And if we include and people belong, then we'll cover all those characteristics we hope to cover that makes us different. So that's one of the aims, or the biggest aim of this project, is how we develop our staff to get it right for our patients. And I'm going to leave it there for now, if that's okay. Thank you, Sue.